Hi, my name is Ken Johnson. I work for LA Sports Performance Care, and this is my model, LA Man. And we're going to demonstrate pelvic tilts today with Tidal breathing. Pelvic tilt is being able to do a full pelvic tilt is critical for the health of the lumbo-pelvic hip complex. And a lot of athletes, their lumbo-pelvic hip complex is actually shut down. So they have a struggle with proper femur extension, proper pelvic extension, proper SI joint movement, and this is a great exercise to kind of go ahead and get athletes in touch with this region. So the first part we're going to go over actually is we're going to go over the tidal breathing, and that's basically being able to take a full inhalation and exhalation properly. A lot of athletes actually, or just patients in general, breathe in their chest and their neck, and they don't really move their stomach in. They've actually been taught to actually suck their stomach in, which actually contracts the diaphragm. So now Allie's going to demonstrate that. So she's going to put one hand on her chest and one hand on her stomach. Okay, and what we want is we want the hand on her stomach to actually rise higher than a hand on her chest. So she's going to take a nice deep breath in through her nose, and then exhale through her mouth slowly. And you should see that her stomach actually moves more than her chest. And the reason this needs to happen is as the stomach actually relaxes, it allows the diaphragm to fall, which allows the lungs to expand. We're going to actually incorporate this with the pelvic tilt. So now what Allie's going to do, she's going to put her hands out by her sides. Her knees and feet are going to be at hip width apart. She's going to have her arms at a 45-degree angle. She's looking straight up at the ceiling. And now Allie's going to rock her pelvis back and forth. Now she's actually initiating this with her pelvis and not just with her upper body. So if you actually watch her entire body move, she's actually moving her pelvis. You don't see her trying to go ahead and accessorize this movement by actually lifting her chest or her head or her upper spine, the thoracic or cervical spine, to actually incorporate movement down in her pelvis and level pelvic hip complex. And as she actually rocks her pelvis forward, you see that she's actually relaxing her stomach some. So she's actually using her hip flexors and her erectors to actually help move her pelvis, as well as some of her deep abdominal musculature. Now as she rocks back, she's going to actually draw on her stomach and actually squeeze her glutes. That allows us to go ahead and get the last part of the posterior tilt. Now she's going to incorporate the tidal breathing. So she's going to inhale as she goes into her anterior tilt, and then she's going to exhale and draw her stomach in and squeeze her glutes as she goes into posterior tilt. Very good. So what I'd like for our patients to do is for our patients to do 10 to 20 reps, 3 to 4 sets. Okay. If you experience any sort of back pain, then you need to cease immediately and go ahead and contact your therapist or your doctor. But this is a brilliant exercise to do to go ahead and actually get all the spinal segments in the pelvis and the hip moving and incorporating that with breathing.